Okay, everyone, so we got cut off because my battery died and it's not holding a charge very long. So we'll see how it goes. So just to clarify with metabolic syndrome, what I want to make sure that you understand is that it's a group of risk factors, okay? Group of risk factors that typically increase a risk for heart disease, heart attacks, and diabetes by 5 times. Those risk factors, 3 of 5 of them, and they are typically high blood pressure, high blood sugar, and high cholesterol, okay? So that's typical. And when those 3 have been diagnosed, then you are known to have metabolic syndrome. Okay, I hope that is clear. All right, so there are some other culprits. You don't have to know too much detail about this, but some of the other culprits are, like it just says right there, the homocysteine levels. This is an amino acid found in the blood. People that usually have higher levels of them are found to have a greater chance of coronary artery disease. And also, not too surprisingly, certain infections obviously can inflame the arteries. So certainly like pneumonia or herpes absolutely can inflame the arteries and make sure that coronary artery disease actually increases, okay? Other culprits, proteins. You have probably heard of C-reactive protein, which is, you'll see that CRP. You might have heard of that in the hospital. When they do labs, a lot of the times they'll do these as cardiac markers and look at this. It's just a marker for inflamed arterial walls. They're looking for C-reactive protein or CRP. Okay, when you're in the hospital with me, we'll probably see lots of these labs drawn. Lipoproteins, that's a blood protein passed on from generation to generation. That's kind of what we talked about. A lot of the times, this is your lipids or your triglycerides, LDL, HDL that is in your blood. They definitely raise the risk for coronary artery disease, sometimes doubling the risk. It usually, like I said, represents LDL. Also, because it can resemble LDL, which is your bad cholesterol, it kind of slows the removal of clots. So if there are clots being formed, it's going to kind of slow the removal of those clots, but also, which would also allow them to stick to the arterial walls. Oxidized LDL, it's just a modified form of cholesterol, LDL. You don't need to know too much about that. I have some information on that, but I'm not going to focus on that if you're wondering for a test. Okay, so serum lipids, here we go. Cholesterol, tasteless, odorous, white, fatty, sterile, produced by the body, okay? Not necessary to know exactly the definition. However, you do need to know cholesterol. Obviously, we've talked about it since I've been lecturing to you. So 2 different types there. Your HDL, which is your good cholesterol. That's when we want to see higher levels of that. So we want to see a high levels of HDL, which is your high density lipoprotein. Low density lipoprotein, your LDLs, your bad cholesterol, okay? A lot of the time, cholesterol comes from 2 sources. Food that is manufactured by the liver or the intestines. So it's typically broken down into saturated or unsaturated fatty acids, and then we store it. So obviously there is some disorders that families are at risk for this. Can be genetic. They can already have high triglycerides and high cholesterol. Can be hereditary, like we talked about. We are always, if this is a history in your family, it's not unusual for a doctor to urge the patient to make sure that they're screening their patients. For instance, I had mentioned again, Professor Cook, her husband, had really high cholesterol, which caused him to have his 5-vessel disease. So with that being so high and that being hereditary, their doctor, their physician, recommended that their 2 boys, which at the time were 5 and 8, I believe, recommended that they get checked for cholesterol. So they get their lipoproteins and their check to see where their triglycerides are, where their LDL and HDL are. So just that triglycerides, like it says there on the screen, lipids composed of 3 fatty acids. Okay, so we focus on these things when we believe our patients are at risk for coronary artery disease. All right, so a little bit more detail. High, like I said, HDL is a good cholesterol in proportion to LDL. Okay, high LDL doubles the chance of coronary artery disease, and I mentioned briefly that I have chosen a vegan diet, and with that being said, I have decreased dramatically my LDL. My cholesterol in general, my triglycerides have gone down dramatically. My total cholesterol has gone down. My LDL, my bad cholesterol, has gone down. Now, the one thing I was disappointed was my HDL wasn't in a bad range. However, it wasn't high. So if you look at the screen there, it says exercise can increase the HDL. So what I want to tell you, and what I have found from research is that I, who's got a great diet and eating the things that I need to make sure that my cholesterol is where it needs to be, the only way I'm going to get my HDL up now that I've changed my diet is to exercise. So that's what I have to accomplish now. Now I've worked on my diet. Now I got to start incorporating exercise because I want my HDL to be higher. That will help, like it says on the screen, to clear that fat from your blood. Okay, so when we're eating, if I have high HDL and I decide I'm gonna have a cheeseburger today, that HDL may help to clear some of that fat load. So when we're looking at labs, we want to make sure this is typically what we're seeing. Normal total cholesterol should be less than 200. HDL ideally should be greater than 40. I think mine was in the 55 range, and I wanted it to be greater than 60. LDL, we want it to be less than 100. LDL greater than 160 is a high risk for coronary artery disease. Your total cholesterol to your HDL ratio should be less than 4.5. Triglycerides should be less than 150. Okay. Those are standard. Those you will want to commit to memory. Those are your typical labs for cholesterol. Okay, so this is just some recapping of information. This is just some stats. So people with high cholesterol have about twice the risk of heart disease. Okay, 71 million Americans have high LDL or bad cholesterol. That's a lot. 1 out of 3 adults with high cholesterol has that condition under control. 2 of 3 do not. So my husband has very high cholesterol. He doesn't take his statins, so it's not in control. Less than half the adults with high LDL cholesterol get treatment. So less than half even get treatment. They don't want to take them. They don't like how the medications make them feel. Lowering your cholesterol can reduce your risk of having a heart attack. That's what this is all about. It will lower your need for hopefully having a heart bypass or an angioplasty or dying. Exercising, eating a healthy diet, and not smoking will help you prevent high cholesterol and reduce your levels. That's all there is to it. What I am telling you too from the research, if you commit to a healthy diet where it's more plant-based and less animal fats, you can reverse your buildup of plaque in your vessels. You can decrease your risk of coronary artery disease. That's huge, just based on diet alone. High cholesterol has no symptoms. Right now, all I don't know what my cholesterol is. You guys probably don't know what yours is, but according to the statistics, all of us have some varying degree of coronary artery disease. 20s, 30s, 40s, we start developing it. We think we're invincible in our early decades. It's not until we start to get symptoms in our 40s and 50s that we start paying attention, but at that point, we've already developed those plaques in our vessels. Okay, so progression of development. This came right from your book. This picture here is right from your book, okay? So I want you to pay attention to this because this is the progression. This is how we develop plaque in our arteries, okay? It's very simple. You can look here. This is A. We have a very nice little artery here. But usually what starts is we will have, like it says right there on the screen, we'll have an injury to this vessel. Something will happen, okay? Then we'll start to form what our body normally does, bring platelets and fibrin to the injury, okay? And we'll migrate here. And then we'll start to grow more cells, okay? We're going to start to pack that in. All right, and then fats start to accumulate, okay? You see these little yellow streaks right here? It starts to accumulate on top of where that injury was. And then over time, we'll have some thrombus formation and ulceration. Oh, and this screen kind of got screwed up here. But what happens is on this last one here, calcification develops, okay? It starts to get hard. And little plaques start to build, collagen comes in here, and it gets nice and hard there. So this is our plaque formation, okay? So if you can think of when you have an injury to your finger, you've cut your finger open, what happens? We apply some pressure. But what happens? We apply pressure, our body goes, hey, oh no, we're bleeding, so let's start the inflammatory response. And they send a bunch of platelets there. They send fibrin there. Your skin starts to make more cells that proliferate so that we can pack that in. Lipids show up there. Accumulation of that fibrous tissue starts accumulating. A clot forms. Okay, and then that calcification, and then we heal. That's our heal. That calcification, those ulcerations and things like that, is like that scab. So it builds there, and it's hard, and that plaque develops right here. So very much like on our finger, that's what happens. Okay, our body is amazing in that it does that just for the tip of our finger. I apologize. However, it also does it when we have an injury in our vessel. Okay. So we don't want it to happen here, but it has to happen here because that's a normal body response. So sometimes you hear people talk about half of coronary artery disease is combating our cholesterol, but the other half is inflammation, preventing inflammation. So you talk about those people who are a little bit more about prevention. We'll eat more fatty acids because they get rid of free radicals, or they help to prevent the inflammatory response. So when you hear things like that, this is what they're talking about, preventing a response similar to this so that we don't develop this. So half the battle is eating the right foods, the other half is preventing injury, okay? So I would like you, if I just back up for a second, to make sure that you understand this, okay? I want you to make sure that you understand this phase, this progression, A, B, C, and D. So I would ask that you look at this in your book and commit it to, not to, so much to memory, but the understanding of it, okay? Because I want you to understand exactly why this is happening to your body. I want you to understand what happens, the progression of platelet aggregation. If this makes sense, I'm going to ask you in the clinical setting, you might ask, you're taking aspirin, your patient's taking aspirin, why are they taking aspirin? And they're getting 81 milligrams. You say, oh, for pain? Well, no, that's not why. At 81 milligrams, you're not taking aspirin for pain. Also, that's a cop-out. So what does aspirin do? When you looked it up, what does it do? Well, I don't know. Well, you better find out. Because one of the things you will find out is that it prevents platelet aggregation. So when we talk about this response here, and we talk about thrombus formation, we talk about platelet interaction, we're talking about aggregation. When I say platelet aggregation, aggregation is the formation of clots, the formation where platelets come together and collect, okay? So we take an 81 milligram baby aspirin that prevents platelet aggregation. Can you see how it can prevent a clot from building here and then plaque building up eventually? That should make sense to you. So when I ask you, so why is your patient taking this? Well, they have coronary artery disease, or they have had a history of a heart attack, or they have angina, or they have had a bypass in the past. Whatever your patient has had, and that's at 81 milligram, most likely it's a prevention of platelet aggregation. And it's to help prevent these stages here. Okay, so please make sure you understand that. Okay, clinical manifestations. So what are you going to see? Well, we talked about that coronary artery disease. We could all have it sitting here and it would be asymptomatic, so we don't even know we have it. Atherosclerosis progresses slowly. So what we saw in this slide here, that progresses slowly. So a lot of the times we don't have symptoms, even at this stage, because our body is so good at compensating. Half of this, our artery can be clotted off or have a plaque there, a calcification, and we're perfusing just fine. Remember, we have a ton of other vessels too. So blockage must be large enough to inhibit the adequate oxygenation or blood supply to the myocardium. All right? So unfortunately, before we really find out that we have coronary artery disease, we end up having symptoms, and a lot of the times it's the chest pain that takes us to the ER and we're starting to have a heart attack. Okay? So it's always good to do preventive measures now, which is exercise and diet. All right, men are from Mars and women are from Venus. And the reason that we say that is because we both develop the disease differently. We also have symptoms that are different when we are talking about coronary artery disease. We are different in more ways than one. Women's symptoms are different from men. We've heard that. Usually with women, 70% experience fatigue. Well, if you're a mom, you're fatigued all the time. Especially if you're a mom who then is working full-time and going to school. 70%